Hello guys, welcome back to Clinically Clear. Today we'll be covering the next refractory error, that is astigmatism or astigmatism, however you would like to pronounce it. So let's start with it. So abnormal refractory state of the eye in which the refractory power varies between different meridians and axes. There is no true focal point. That is basically, let's say this is one axis and this is another axis. The light rays that are coming like that, they are going through a different power. The light rays that are coming like this, they are going through a different power. So the refractory power, it varies between different axes and meridians. So let's classify it based on the etiology. The most common type of astigmatism is corneal astigmatism, where the curvature of the cornea differs from one axis to another. The vertical curvature might be different, the horizontal curvature might be different. So that is corneal astigmatism, and most of the times when we say astigmatism, we are referring to corneal astigmatism. Next, coming to lenticular astigmatism. Now, what is lenticular astigmatism? In lenticular astigmatism, the curvature of the lens, example, due to lenticonus, the curvature of the lens can differ between one axis to another. The refractory index can differ along one meridian to another, or because of the lens itself tilting in one way, the power on one side might be different to the power on the other axis. So it can be positional. Or you can rarely have retinal astigmatism where the retina itself tilts such that the macula there undergoes tilting and the light rays are being focused at different points, so there is no true focal point. But these all, you just remember the names. What's important is corneal astigmatism, where the curvature of the cornea is different along different axes. So next, coming to the two main types of astigmatism, that is regular and irregular. See, in regular you have two principal meridians. Now what are these two principal meridians? Most of the times there is one vertical meridian and one horizontal meridian. They always have to be perpendicular to each other. That is regular. Irregular astigmatism, you have multiple different meridians. They have no geometric relation to each other. They have no geometric relation to each other. They need not be vertical. It can be one like that, one like this, one like that, one like this, one like this. Example, when there is any corneal scarring, let's say there's an irregular scar over the cornea, then obviously there is no like proper vertical meridian, horizontal meridian. So in these cases, we can't correct it optically. We prefer surgical correction. Understood? Now, the types of regular astigmatism based on the refraction of light. Now, this is simple. First, we have simple astigmatism. Simple astigmatism, light rays coming along one meridian. Let's say the horizontal light rays. They are having normal refractive power. The horizontal meridian, normal power, so being normally focused on the retina. See here, the purple rays are being focused on the retina. Whereas the other axis, the light rays coming from the other axis, either they are going through myopia where the power is myopic, or there is hypermetropia where the light rays coming to the other axis are being focused behind the retina. So if let's say the other axis is myopic, then it will lead to simple myopic astigmatism, and if the other axis is hypermetropic, it will lead to simple hypermetropic astigmatism. So this is simple astigmatism. In compound astigmatism, both the meridians have the same type of refractory error. That is, axis 1, axis 2, both have myopia here. So compound myopic astigmatism. Axis 1, axis 2, both have hypermetropia here. Both are being focused behind the retina. So compound hypermetropic astigmatism. So why can't we just call this myopia? We can't call it myopia because you can see that the myopia, the degree of myopia along one axis is different to the degree of myopia along the other axis. That is why it is both the meridians have same type of refractory error but of unequal degree or of unequal power. Compound myopic astigmatism is actually the most common type of astigmatism. So this is about compound astigmatism. Now, you might have assumed one thing, that what if one axis has myopia and the other axis is hypermetropia? That is exactly known as mixed astigmatism. One meridian hypermetropia and the other meridian you have myopia. But the one special thing about mixed astigmatism is the least visual defect out of all types of astigmatism is in mixed astigmatism because the circle of least diffusion falls on the retina. Now, what is the circle of least diffusion? You will find out when I talk about Sturm's conoid, but basically, for now you remember that the least vision defect is in astigmatism, mixed astigmatism. So these are the three refractory types: simple, where one axis normal, other axis either myopia or hypermetropia; Compound, both the axes have the same refractory error but of unequal degree. Unequal degree, compound myopic astigmatism, compound hypermetropic astigmatism, and third is mixed astigmatism, where one axis myopia and the other axis hypermetropia. Next, coming to the classification based on the axis or based on the meridians. See, now there is a rule in our eye that is basically slightly in our cornea, the vertical curvature is a bit more than the horizontal curvature. Why do you think that is? Our eyelids, they exert pressure from up and below that causes the cornea to bulge vertically a little bit. So that is why the vertical curvature is said to be a slightly more than horizontal curvature. So using this rule, we have three types. With the rule astigmatism, as you can see, Volkswagen, W for with the rule and V for vertical. Here it follows this rule. It is a type of astigmatism where the vertical curvature is more than the horizontal curvature. Understood? So because the wherever curvature is more, power is more. Because more the curvature, lesser the focal length, more the power. So with the rule astigmatism, the vertical power is more than the horizontal power. Against the rule astigmatism, it asks the rule, no, I am not following the rule, I am going completely opposite, pulls a complete 180. So here the horizontal curvature is much more than the vertical curvature. So because of that, what happens? The horizontal power is more than the vertical power. So this is against the rule of astigmatism. Oblique astigmatism is completely different, where you have two principal meridians which are perpendicular to each other, but they are not along the vertical and the horizontal axis. They can be tilted to an angle. Example, here I've taken one meridian at 45 degree, one meridian at 135 degree. So you have two principal meridians which are perpendicular, but they are not aligned with vertical and horizontal axis. So that is about this thing. What the three types of astigmatism based on the principal axis of the meridian, that is with the rule astigmatism, against the rule astigmatism, and oblique astigmatism. Now, as I told you before, what is Sturm's conoid? Now, before we go to Sturm's conoid, see, Sturm's conoid is basically how the light rays are arranged once it passes through a toric surface. What is a toric surface? Any surface where the vertical curvature and the horizontal curvature are not equal. Now, let us assume that we take a toric transparent surface where the vertical curvature is more than the horizontal curvature. That is, vertically it is much more curved, horizontally it is less curved. So because of that, what happens? Vertically there is more converging power, horizontally there is less converging power. Now let us come to this diagram. Now this requires a bit of imagination. So let's say you have vertical rays coming. Now vertical rays are facing much more converging power. So the vertical rays immediately start converging. The horizontal rays, they have less power. So they start converging, but not by such a great degree. So initially, here as you can see, you have the vertical convergence being more than the horizontal convergence. So hence you have a horizontal oval. But the horizontal rays also are converging. So the horizontal oval starts getting thinner and thinner, flatter and flatter, and also shorter and shorter. Eventually, the vertical rays focus at a single point. Horizontal rays, they are still converging. Why? Because power is less. So wherever the vertical rays converge, the vertical rays are just formed a point. The horizontal rays are still converging. That is why there you have a simple horizontal line. That's it. Imagine you just have horizontal rays of light and the vertical rays have all converged at a point. Then after this, the vertical rays now start diverging. Horizontal rays are still converging. And at this point, horizontal convergence is more than vertical divergence. So once again, it forms a horizontal oval. But then vertical rays are diverging, horizontal rays are converging. There comes a point where you have a circle where the divergence of vertical rays becomes equal to that of convergence of horizontal rays. So this is why this part is known as circle of least diffusion, and this is exactly why in mixed astigmatism we have the least visual defect. See, you can see here that these light rays have converged and now they have started diverging. These light rays are still converging, so the circle of least diffusion falls on the retina. So that is why you have the least visual defect. So as I said, where the divergence of the vertical rays becomes equal to the convergence of horizontal rays, that is where you will have circle of least diffusion. Then what happens? The vertical rays start diverging and the horizontal rays have converged. So now it starts forming a vertical oval. It forms a vertical oval. Eventually, all the horizontal rays converge at a point. Vertical rays are still diverging. So there you will have a simple vertical line. And then horizontal rays also diverging, vertical rays also diverging. So from then on, you'll always have a vertical oval that is increasing more and more in size. Understood? So this is about Sturm's conoid. What is important here is circle of least diffusion, which we want to be on the retina for minimum loss of vision. So what are the symptoms? Obviously, you have no true focal point. 1 axis, 1 refractory power. So there is blurring of image, there is stretching of objects, there is merging of letters, there is distortion of images. So these are all the visual defects. Understood? Then coming to asthenopia. Now, what is asthenopia? Asthenopia is basically, what is asthenopia? Asthenopia is basically because see, I'll tell you why asthenopia comes. See, half shunting of eyelids for pinhole effect. As I've told in the previous video, when we shunt our eyelids a bit, only the central rays are allowed. The central rays will anyways hit the retina, so vision will be good. So you're blocking the peripheral rays which are not being focused on the retina. So when you do this half shunting again and again and again and again, what happens? Patient starts getting headache, fatigue, tiredness. That is nothing but asthenopia. And now let's say the patient has oblique astigmatism. What is oblique astigmatism? As I told, you have two principal meridians which are not horizontal and vertical but are at an angle. So what does the patient do? The patient tilts their head so that those two principal meridians are aligned with the vertical and the horizontal axis. That is head tilt. So these are the four main symptoms. And coming to the signs, simple. Keratometry. When you do keratometry, you can see that corneal curvature differs from one meridian to another. And when you do autorefractometry and retinoscopy, you can see that the refractory power differs from one meridian to another. Simple, both are correlated. One curvature you will see through keratometry, power you will see through autorefractometry. Then coming to the treatment, the management. Surgical treatment, yeah, you can do LASIK and all that. But let's look at the optical treatment. Astigmatism, meaning the only thing that should come to your mind is cylindrical lens. See, this is a spherical lens where I've cut it out of a sphere. Here you have vertical curvature and you have horizontal curvature. This is a cylindrical lens. See, this is the axis of the cylinder. I've cut it such that here there is no vertical curvature, but horizontal curvature you do have. So that is why only along one axis you'll have curvature. Understood? Cylindrical lens also, the rule while prescribing is the axis of the cylinder. This is the axis of the cylinder. This has to be perpendicular to the meridian you want to correct. Now, how do I explain this? Now, let's say the vertical rays are coming. Okay, and the vertical rays are being focused in front of the retina. They are myopic. Horizontal rays are totally fine. Okay. For myopic astigmatism, we give plano-concave cylindrical lens. For hypermetropic astigmatism, we give plano-convex cylindrical lens. Basically, myopia meaning concave, but here it is astigmatism, so cylindrical, so plano-concave. Hypermetropia meaning convex, here it is hypermetropic astigmatism, so cylindrical, so plano-convex. Understood? Okay. Now let's say the vertical rays are coming. Vertical rays, myopia. Horizontal rays, totally normal, falling on the retina. What is that? Simple myopic astigmatism. Now, we don't want the horizontal rays, we don't want to alter the horizontal rays. So, these horizontal rays have to pass through a straight surface without any curvature. But these vertical rays, we want it to pass through a concave surface. So, we give a plano-concave lens such that the curvature is this way. So, it is a cylinder such that the curvature is this way, but here in this axis all you have is a straight line, but here you have a curvature. I hope you can imagine what I'm telling. Basically, see, this is the axis of the cylinder, right? The axis of the cylinder is where you have the straight surface. So that part you don't want to correct. That is where you want the normal light rays to pass through. We want to correct the myopic light rays. I know it sounds a bit confusing, but I'm trying my best to convey it. If not, you can either ask me in person or something like that. But anyways, this is about spectacle lenses where you give cylindrical lenses. Let's say you want to use contact lens. Then we'll use toric lenses. Now, what are toric lenses? As I told, toric surfaces are where vertical curvature is not equal to horizontal curvature. So, we give toric surfaces such that that circle of least diffusion is there, right? We want that to fall on the retina. Simple. So, toric lenses for contact, plano-concave for myopic astigmatism, plano-convex for hypermetropic astigmatism. The cylindrical lens axis should be always perpendicular to the meridian you want to correct. So that is about astigmatism. I hope you guys enjoyed the video. Thank you for watching.